Hello, everyone, and welcome to the FIP CPD Bite on Sustainability of Healthcare Systems. I'm Dr. Andrea Bruno-Tomé, Director of Research, Policy and Partnerships at the Australian Pharmacy Council. Today, we're going to explore a critical intersection that has shaping the future of healthcare, the connection between workforce sustainability and environmental sustainability. By the end of our session, you'll understand these interlinkages, identify key strategies for building a sustainable, focused pharmacy workforce, and be equipped to develop actionable plans for your own practice setting. These are the contents that we will explore today. Let's start with a fundamental truth that underpins everything. As the World Health Organization states in their landmark report, A Universal Truth, there is no health without a workforce. And in our case, without a pharmacy workforce. The WHO estimates we're looking at a global shortfall of 10 to 18 million health workers by 2030. And that's just 5 years away. To put this in perspective, that's equivalent to losing the entire health workforce of several countries combined. The WHO Workforce 2030 strategy emphasizes three critical pillars: sustainability, equity, and resilience. These aren't separate goals. They're interconnected elements that must work together, because the reality is that health systems can only function with health workers. But our workforce challenges don't exist in isolation. They're happening alongside unprecedented environmental changes that are reshaping the healthcare delivery. But before we dive into current challenges, let's establish what sustainability means in this context. At its core, sustainability means meeting present health needs without compromising future generations. In pharmacy, sustainability spans across workforce and education, practice and science, extending far beyond just environmental issues. The three key priority areas that form the pillars of sustainability are environmental stewardship, economic viability, and social responsibility. Pharmacists play vital roles across all three of them, from medication management and patient education to waste reduction and community health promotion. Let me paint you a picture of what we're dealing with right now. Our workforce is under pressure from multiple directions. We're seeing critical shortage, particularly in rural and remote areas, compounded by our aging population, increasing health needs. Burnout has reached crisis levels, and recent global events had only made this worse. We're experiencing significant migration patterns, with a concerned brain drain from lower resource settings to high income countries, which creates global inequalities. Gender inequality persists, with underrepresentation in leadership positions across healthcare systems. But where it gets more complex, these workforce challenges are happening alongside environmental changes that directly impact human health. Healthcare workers are facing acute injuries and chronic exposures from environmental hazards. We're dealing with stressors from climate-related disasters and disruptions in care delivery. Our health systems are experiencing impacts to infrastructure and supply chains, while the very conditions that promote human health and well-being are being eroded. This is where workforce sustainability and environmental sustainability converge. We cannot address one without addressing the other. So how do we respond? We need a comprehensive approach to building a sustainability-focused pharmacy workforce. First, let's talk about attraction and retention strategies. We need competitive compensation. People can't be expected to work in challenging conditions without a fair remuneration. We must create clear career development pathways that show healthcare workers that they do have a future in the profession. And critically, We need safe and inclusive workplace where people want to work and can thrive. But attraction and retention aren't enough. We need to train for sustainability. This means integrating climate health education into our curriculum and promoting interdisciplinary collaboration. Future pharmacists need to understand how environmental factors affect health outcomes and medicines. Policy and planning are equally important. We need robust workforce data systems and national health workforce to make informed decisions about resource allocation and planning. Here's a striking fact. Healthcare contributes approximately 5% of global emissions, but there's an opportunity. Planetary health isn't just another science topic. It's a chance to transform professional identity for future generations. Future health professions, including pharmacists, need to see themselves as protectors of public health, stewards of environmental sustainability, educators of their peers and the public, and advocates for a just and sustainable world. Let's look ahead. What does a future-proofed healthcare system look like? First, resilience. Our systems must be adaptable to crises, whether they're pandemic, natural disasters, or supply chain disruptions. We've learned this lesson the hard way in the past few years. Second, integration. We need team-based care models and digital health solutions that make healthcare more efficient and accessible. Pharmacists are perfectly positioned to lead in this space. Third, sustainability in infrastructure. This means low carbon healthcare facilities and embracing circular economy principles in healthcare operations, reducing waste, reusing materials, and recycling where possible. But perhaps most importantly, we need to maintain trustworthiness and credibility. Healthcare professions, especially pharmacists, are consistently among the most trusted voices globally. This gives us tremendous power and responsibility to advocate for sustainable practice. Finally, accessibility. We need community-based care models that bring healthcare closer to where people live and work, reducing travel-related emissions while improving access. Pharmacists are uniquely positioned in all of these areas. We are community-based, accessible, trusted, and have the clinical expertise to make a real difference. Let me leave you with this powerful quote from the lesson Countdown. Climate change is the greatest global health threat facing the world in the 21st century, but is also the greatest opportunity to redefine the social and environmental determinants of health. This captures both the challenge and the opportunity before us. Climate change is already affecting the health and well-being of our communities. Workforce sustainability is essential for healthcare systems sustainability. You cannot have one without the other. As pharmacists, we are key stakeholders in both workforce and environmental strategies. We're on the front lines of healthcare delivery, trusted community voices, and have the clinical expertise to understand the health impacts of environmental change. Global frameworks and programs like the FIP-DG 21 on sustainability can offer guidance, but local action is where change happens. That's where you come in. Collaboration, innovation, and policy reform are critical, but it starts with individual commitment and action. Health professions can be the most effective champions for climate solutions because you see the health impacts firsthand. I encourage you to explore the research I will share, including the FIP sustainability resources, WHO operational frameworks, and the WHO Academy Climate Change and Health course. These will help you develop the specific action plans we discussed as one of our learning objectives. Remember, building a sustainable healthcare system isn't just about environmental responsibility. It's about ensuring we have the workforce and systems needed to care for our communities now and in the future. Thank you for watching this CPD Bite, and your commitment to building a more sustainable workforce for healthcare. Together, we can make a difference.